So sometimes we wonder if we have dementia or if somebody we know has dementia. So how is it that we can figure out whether somebody has it? I'm going to describe some symptoms. And sometimes these are symptoms that people may have normally, right? So if you have somebody who doesn't necessarily like to be in large groups and they never have liked to be in large groups, that doesn't necessarily mean they've had dementia. So things I'm going to be describing are if you've seen a change in the behavior of the person that you're wondering if they may have dementia. So some of the things might be word finding. Instead of saying, hand me the pen, they'll say things like, can you hand me that thing over there that you write with, right? They're not able to find the word pen. So they're describing what it is that they want. It's difficult for them to hold a detailed conversation. They may sit back and just sit quietly and not engage. They may, they're able to have what's called automatic conversation, which means you can say, hi, how are you? And they respond, I'm fine, how are you? Right? That's just an automatic conversation that a lot of people have. If you sit down and try to talk to them about a political debate or something in the news, they might not be able to really engage in that if they have dementia when they would have been able to do that in the past. They might isolate from large gatherings. Sometimes it can be a little overwhelming if you're in a large group of people. You're starting to lose your memory. You don't know who these people are anymore. So it's a little intimidating, and so they may not want to go, or they may get up and walk out and they don't want to be in there, or if it's too loud and they're not able to really identify what's being said and it gets overwhelming. You might see them have some agitation in a situation like that. Visual perception. They might go to sit down on a chair and miss the chair because their mind is not really seeing exactly what it is. When somebody has advanced dementia, if there's like a dark carpet on the floor, sometimes they'll think it's a hole in the floor. They won't realize that it's actually a carpet, and so they'll step over it because they think it's a hole and they don't want to fall in it. They won't remember that they've seen you. Sometimes you go to visit and they're like, oh my goodness, it's so good to see you, it's been so long. But maybe you've been there in the morning, right? So that's the short-term memory loss. They lose things, misplace them, put them somewhere else, think somebody has stolen them. I think one of the funniest things was when I worked in nursing homes, people always thought you were stealing their teeth because they didn't know where they were. Why in the world would anybody steal teeth? But that would be something that they'd misplace, right? And then they wouldn't know where they were, so they would think that someone stole them. They stop paying their bills, or maybe if they were really good at keeping a checking account or their office was really organized, becomes extremely disorganized. They don't pay their bills, they double pay their bills, they don't balance their checkbook. Somebody who was a really good cook can't follow a recipe anymore, or can't remember a recipe in their head that maybe they had made over and over again. They might wear dirty clothes because they don't remember how to wash. They can't use the wash anymore. It's too overwhelming, so they just don't wash them and they'll wear dirty clothes. They're not able to remember details. So maybe if they were somebody who would knit or do some kind of a craft or woodworking, they can't do it anymore because they can't remember the steps that they go through. So they stop doing it. So a lot of times people will think that someone is depressed because they're isolating, they're not doing activities, they're not eating, but it might be because they have dementia and they don't remember how to cook and they don't remember how to do the activities, and it becomes overwhelming in front of people. So it's really good to try to figure out if you're seeing any of these symptoms, to go to a physician and find out what the issue is. It could be depression or it could be dementia.